Welcome, everyone. We'll give folks just a few minutes to hop in. Um, Hope you're enjoying your Friday. Excited to have this wonderful opportunity with several experts in the field, I like to call it. But see, we got about 15 folks in the room, so I'll go ahead and kick things off. Welcome to our session today on the value proposition of sustainability, empowering healthcare leaders for social responsibility and environmental stewardship. My name is Jen Petit, and I serve as the Senior Manager for Leadership Programs within CHL. I do have a few housekeeping items before we get started and kick things off. One, we are recording today's session, and we will have that available to anyone that is registered for the event in the next few days, so you can expect that in an email. We are also utilizing or will be utilizing closed captioning once we get that started. So once we've enabled that, feel free to enable yours in the Zoom menu below. We are also utilizing the Q&A function today, so be on the lookout for if you have questions or questions of your fellow attendees will pop up in that Q&A section, and we'll try and get as many of those answered as we can. We will not also be unmuting folks for this session today. So if you have any concerns or anything that you need to send to myself or the panelists, feel free to do that via the chat function and we can figure that out from there. I think those are all of my announcements, but I'd like to hand things over to our moderator today. Soledad Heron is the Program Manager at Sodexo for Sustainability, Wellness, and Clinical. Welcome.
Thank you, Jen. So excited to be here and so excited to introduce our esteemed guests that have a world of knowledge and expertise in the space of healthcare and sustainability. I'm going to start off with Terry Dufina. She is the Director of Sustainability for their program office with Stanford Healthcare. Terry, do you want to say a few things about your work?
Sure. Can you hear me okay?
Yep, great.
Great. My name, as Soledad mentioned, Terry Dufina. I've been with Stanford Healthcare now for 8 years. I've been leading a massive expansion of the sustainability efforts at the organization, taking us from a team of myself and one part-time consultant to a full-blown team of about 12 sustainability professionals now. Super proud of all of that work. We have had a lot of lessons along the way, and I'm happy to be here today and to share those with you. Thank you.
Thank you, Terry. And next, I want to introduce Christina Indiveri. She is the Associate Vice President, Environmental Sustainability at Vizient.
Good afternoon. Thanks so much for having me, Soledad. And thank you to the audience for engaging with us on this Friday afternoon. Christina Indiveri, AVP, I support and lead environmental sustainability on behalf of Vizient. Been here for about 6.5 years, and it's really an honor to do so, to be able to launch and implement customized solutions for providers and suppliers to accelerate sustainability performance improvement. So thanks so much for having me.
I am so excited to get this conversation going because I know that there are a lot of questions in the field about how do we get started. We love wanting to do this work, and to have both of you on this call to be able to impart some of that knowledge, learning, and experience will be greatly valued, I'm sure, amongst the listeners on the call. So with that being said, let me start off with our first question. With healthcare being in the space of supporting the community and having the intention of being good stewards of the environment, what do you believe are the main drivers of healthcare with taking a leap towards making formal environmental sustainability commitments? And with that, let me parlay in your thoughts on legislation, federal initiatives in the landscape of sustainability and healthcare. And with that, I will pass it over to Christina first.
Great. Thanks, Soledad. Great question. So I think of a few drivers at hand, probably 3 in particular. So the first is impact. The US health sector is responsible for an enormous impact compared to other healthcare systems. The health sector is responsible for about 8.5% of US emissions of greenhouse gases, while other healthcare systems contribute around 4.6%. So as the healthcare sector grows, so will our environmental impact. And it seems to be ever expanding. Right now, $1 out of every 5 is being spent on healthcare. And as we all know, healthcare is a 24-hour-a-day operation, 365 days out of the year. And for a quick stat, I know the inpatient healthcare is ranked by the EPA as the second largest commercial energy user in their country. So our impact is quite broad, and that's driving some action. In addition to that, there's a moral imperative to do no harm, and this is from all healthcare organizations. And that moral imperative to do no harm is aligned with mission statements. And that includes providers, suppliers, GPOs, healthcare performance improvement companies like Vizient. It's also becoming harder to ignore how extreme climate events and extreme pollution are endangering human health, with many populations, such as the poor and minority groups and the elderly, particularly vulnerable. And lastly, I think of the evolving regulatory market. So there are several mandates right now, such as California's climate disclosure laws, something that I'm sure Terry is very familiar with, but better known as Senate Bill 253 and 261, which require businesses to report out on their greenhouse gas emissions. The SEC, or Securities and Exchange Commission, also has climate disclosure rules. And there are also several voluntary disclosures. So the Joint Commission offers an optional healthcare sustainability certification. CMS also offers, again, optional decarbonization and resilience initiative. And on top of those disclosures, there are public pledges, such as the HHS, or Health and Human Services Climate Pledge, which asks signers to commit to reducing organizational emissions, designated a lead, and conducting a Scope 3 inventory, and lastly, developing a climate resilience plan. So the market is ever evolving. There are multiple dynamics nudging and encouraging providers, suppliers, and healthcare entities not only to disclose commitments, but also to improve human health.
That was great, Christina. Thank you. Terry, any additional thoughts to that?
Yeah, that was a fantastic summary of the drivers. And I think that the two things that I would add on to that is the first is workforce engagement. You know, our healthcare sector has a very high turnover rate, and we compete, quite frankly, for highly qualified workforce. And what we've found at Stanford Healthcare anyway is that sustainability is an incredible engagement program where the workers, the clinicians, the staff, we acknowledge the impact of our operations on the environment, and we see it every day. And so by creating these programs around the organization, we allow employees to get involved with that and make a difference, which I think it helps us in our hiring and retention efforts. And then, you know, as far as the legislation and federal incentives, a lot of healthcare facilities and providers in particular, we're looking at the IRA, the Inflation Reduction Act, to see how we can take advantage of the tax benefits associated with some of this work. So because that is available, I think more health systems are looking to alternative funding sources for some of the things that they can't afford on their own.
Great response. Thank you, Terry. That leads us to the next question. If the healthcare system was interested in taking steps towards setting sustainability goals, because many of us have signed this health sector climate pledge, and we are beholden to many of the federal and legislation and state legislations around sustainability. Where do you suggest they start? what steps do you think should be taken? And I'll just pass that to whoever wants to answer that first.
Yeah, I think I can take that first, Soledad. I kind of group this into 5 basic steps for systems that are just getting started. The first one is you have to measure your greenhouse gas emissions. That's the fundamental step. We're all looking to do that according to the greenhouse gas protocol. So you want to make sure that you do it using tools that are on the market that align with that protocol. There are now free tools available to help systems who can't afford to hire a body of consultants to do this for them. So there are tools designed specifically for healthcare that enables this measurement to take place. Vizient even offers services to help with these baseline assessments. So there is a plethora of tools available to health systems today that weren't maybe available 5 years ago. The second step in the journey, I think, is finding and supporting partners and champions around your organization. Excuse me. Because these champions are everywhere. They will use their discretionary time, whatever time that is, to work on sustainability initiatives if you find the right ones, and their enthusiasm will ignite others. This is the way you create a buzz in the organization around improvements, and you make those improvements visible. So, which leads me into the third item, which is promoting all of the achievements. However small you might think they are, people get energized when they hear of other people taking action to improve the work environment or to improve sustainability. So when I tell the story about the nurses on one patient unit who collect the little plastic lids that are all different colored from the medications, and they create art with them, or they create badge designs with them, that kind of gives other people ideas and kind of encourages more efforts overall. So promoting that is important. And then next is researching to find an executive champion. It's really important at some point in the program that somebody at the highest levels of the organization can champion the effort. You can start as a grassroots kind of scrappy, get things done group, but when it comes to building a program, you need an executive champion, but it doesn't necessarily have to be the executive in your chain of command. So if, I happen to have our chief technology officer happens to be super into sustainability, and he's like, what can we do? And how can I help? And he's willing to kind of lean in from his leadership role and advocate for sustainability, even though my department doesn't fall directly within his chain of command. The next one is building relationships. So no sustainability practice is going to be successful without really good relationships between the sustainability team and the rest of the organization. No one can do this work alone. So it's about understanding others' goals and asking, how can we do that in a sustainable way to meet our mutual goals? And then helping them achieve those goals so that you're in it with them. You're not just expecting them to change their goals, but you're actually participating in it. So with those 5 steps, you can really, start to build out and start to see the maturation of your sustainability program. I think the one kind of bonus round, if you got past those introductory stages, I think is transparency. Being able to make your data and your programs transparent across your own organization, but also maybe publicly or with some of your trade groups. So we all, in the end, want to be transparent with this sustainability data with our suppliers, with our competitors, with the whole industry. So, so if we can get to that point, I would say that we could make an impact together.
Those are really well-defined, 5 good steps. And I love the transparency piece, because without it, we don't have the real work. Thank you for that. Christina, do you have anything to add?
Sure. I love Terry's last point about establishing and maturing relationships. I cannot stress enough to reach out to peer groups, suppliers, GPO partners, and industry and association groups. Sustainability is a unique area where we can all benefit from innovative collaboration. Ask a peer for a sample sustainable procurement policy. Partner with your suppliers to request carbon emissions data. Ask industry groups what tools are available. Set up meetings with your GPO to learn more about current resources like data sets and what customized solutions exist. I know here at Vizient, our team offers sustainable procurement insights, conversion opportunities to the cleanest and safest products that decrease cost, and also highlight carbon emissions information within the supply chain. And better yet, there are partners who can convene key industry stakeholders within the provider, the supplier, government, and association spaces to provide expertise and drive meaningful change. And last but not least, start with the small wins, build momentum, and then advance to larger challenges. Some projects may be more visible, like a recycling program. Others may deliver significant cost savings, like a reprocessing program. And others may send a very strong message to evolve the culture, such as implementing a sustainable procurement policy. No matter the project and what has been prioritized, sustainability projects often yield advancements in people or human health, planet, which is a reduced environmental impact, and last but not least, prosperity or cost optimization, better known as the 3 Ps.
I will have to tell you that everybody's ears must be ringing when they heard decreased costs, because so much of the fear out there is that any work in sustainability increases costs. So I'm sure that is piquing a lot of people's interest right now. With that being said, and we touched on a lot of points, really leaning into the developing these strategies, right, towards sustainability targets. How does communication, I know we touched on it a little bit in the previous responses, but how does communication play a role in determining its effectiveness? And what is needed for the commitment and involvement of stakeholders? If you guys can go a little bit more into that. Christina, would you like to begin?
Sure, happy to. It is critical that people are at the core of sustainability. While saving trees and preventing polar bears from being stranded on icebergs may be compelling for some, climate health equates to human health. Actually, earlier this week, I was at a presentation, and for the introduction, someone said, "Oh, this team is going to save the world." And I cringed a bit, and I know my fellow presenters did too, because it's truly about patient health and public safety. Healthy people and vibrant communities cannot exist on a sick planet. And today, there are countless tragic headlines playing on fear and despair. Some are absolutely warranted. And these headlines paint climate change as unobtainable. And we all know that creating change starts with asking questions and connecting with others. Challenging the status quo is furthered by case studies, sharing successes, and intentional collaboration. So I'd end there. And to your second question, Soledad, I know you asked about what's needed for a commitment. To me, it's all about collaboration. Collaborative efforts are needed to build an effective business case. And being sustainable is not only beneficial for business, but it works to improve public health and safety. And we're seeing healthcare organizations increasingly prioritizing sustainability as a strategic initiative to not only reduce the environmental impact, but also to create a more resilient healthcare sector while having significant social, health, and economic rewards. And organizations need to be able to demonstrate and clearly articulate their environmental and social value to patients, staff, regulators, and any other stakeholders.
Thank you, Christina. That was very well said. And Lee, leaning into Terry here, who has done a lot of this work with communication, buy-in of stakeholders to make Stanford very successful in their sustainability efforts. Terry, do you have anything to add?
Yeah, I think that what's most important to kind of ask yourself when you think about communicating about sustainability of your organization, every organization has a different culture, and you really need to evaluate what language and what words resonate with your organization. So, a colleague of mine presented this week, and she was asked, how do I talk about this when my board of directors doesn't want to use these same words like climate change and greenhouse gases? How do we talk about it in a way that resonates with them? And so part of the role of a sustainability professional is to find out what those words that work are. So so it's challenging. It's really challenging because even within an organization, you can find pockets of people that differ, and you have to change your messaging and your words so that you're building champions and not offending anyone. So I think there's that factor. I think in terms of the involvement of stakeholders and what's needed for the commitment of those stakeholders, I want to kind of outline who those stakeholders need to be. Just to, if you're getting started again and you're looking for clues on how to get there, who to even start this communication with, I would recommend starting with the facilities department. That includes both your operations staff who runs the buildings and the teams that build the buildings and conduct renovations, and find your champions within that group, because energy is going to come up on your scope 1 and 2 emissions as your largest contributor. I'm not going to guarantee anything because there's a lot of people and a lot of organizations on this line, but that's your primary focus of those scope 1 and 2 emissions is around energy. And there are a lot of advocates within the facilities profession who want to see more energy efficient buildings. They know what to do. You just have to ask them and help them get it done. So the second one is the second set of stakeholders that's critical if you're a provider is your OR staff. Your clinical areas, at least our clinical areas at Stanford, 90% of our waste that we generate comes out of our clinical environment. It's not the offices and the public spaces and yada, yada. It is out of our clinical environment. And so you need engagement from that team if you're going to make an impact in the waste that's generated by the facility, but also in supply chain purchases. For us, over 70% of our total purchases of products are coming from our clinical environment as well. So influencing those decisions about which products to use is critical in partnership with your OR teams, including clinicians, both physicians and nurses, but as well as students. So I'm fortunate to be at an academic medical center where I have access to medical students. Many of you may have nursing schools or medical schools as well. And the students really want to work on these projects, these improvement projects. So leveraging that enthusiasm. In fact, I give credit to the current phase of our sustainability journey to the students from our medical school for encouraging our leadership to look at sustainability more extensively. Supply chain partners, incredibly important. We'll get into that later. Transportation teams, transportation is going to come up on your greenhouse gas emissions as a significant contributor as well. And then finally, external stakeholders. So your cities and counties may have incentives to help you pay for energy projects. Your waste hauler may have solutions to offer for reducing or increasing reducing landfill or increasing your recycling. And like Christina said earlier, your peer institutions, when it comes to sustainability, we're not competitors. We are absolutely collaborators and support networks, and we're all trying to achieve the same end. So We are definitely in it together. So joining webinars like this to find people who can help, for example. Always willing to help our fellow institutions. So those are some of the stakeholders and what I think you need in order to be successful in achieving your sustainability strategies and goals.
Yeah, that's great. And I think that collaboration piece within the organization, outside of the organization, with strategic partners is key in driving what you're trying to achieve. You guys have answered some of what I'm going to ask in the next one, but I know that you guys have so much more information, so I'm just going to ask it. What are the greatest barriers in building a highly accepted strategy to drive that execution? Because we can make the plan, but how do we execute? Especially on publicly made commitments. Terry, do you want to kick off that one?
Yeah, I can kick that one off. So I think there's probably 3 big barriers that I see. And, you know, one of the superpowers, I think, of a successful sustainability professional is to overcome barriers in the first place. So that is something that, because we're asking people to change the way that they're making decisions or a process that they are very comfortable with. And we have to kind of navigate around all the challenges that we get during that process. So change is hard. Convincing people to do things more sustainably takes a lot of work. And we all know this because how many of us have said we're going to eat better or exercise more often, and we can't even make ourselves change. so overcoming change is probably the biggest barrier and the biggest opportunity as well. The other 2, a lot of people, we've touched on it here, say that money is a barrier. And yes, it is. But you know what is a greater barrier is time. Like there are only so many hours in the day and everybody has a full-time job already. So what we're asking folks to do a lot of times is to carve out some of their valuable time to work on sustainability or to improve processes related to sustainability. That is probably, I think, one of the 3 greatest challenges, because we're either advocating at a leadership level for their staff to be involved with an initiative, or we're trying to get those grassroots organizations kind of kickstarted and working. And all of that is about how are we spending our time, the ultimate constraint. Just to touch on money is hard to get. Half of the hospitals, right, are not even breaking even right now. In California, the state of California just invested in about 16 hospitals to keep the doors open because they just can't make ends meet. So investment is really hard at this point in time. And yes, there are incentives out there, but when you're asking the organization to spend money, you're going to have to be very strategic about it. And you're going to have to think about how you can offset it with savings. So we do ROI analysis, we do life cycle cost analysis. And if you are able to get buy-in on the process that you use to evaluate some of these decisions, they actually come out winners, not losers. But sometimes it takes an upfront investment that takes time to pay off. But there are plenty of money-saving initiatives like reprocessables, like switching from disposables to reusables that have been tested and researched and demonstrated with other organizations. So tying the spend to the savings is a critical success factor with that barrier. And I'll turn it over to Christina for her thoughts.
Thanks, Terry. Well, to me, I think increasing and or competing costs to delivering healthcare comes up as a top barrier. Healthcare leaders have to balance increasing costs against benefits of sustainable products and services. And as you said, at times, so not all the time, but at times, upfront costs may be required to proceed with sustainability projects, such as those that drive energy efficiency and cost savings. However, there are funds available, such as those from the IRA, the Inflation Reduction Act provided by the current administration, or even through green and social bonds provided through reduced interest rates. For an example, Boston Medical Center was the first not-for-profit healthcare system to do this last year, and they're saving about $5.4 million in reduced interest. So we recognize that margins are tight for many provider systems, so an investment in sustainability may not seem like a feasible priority. However, we have helped providers achieve the best of both worlds, identifying sustainable products and services in addition to cost savings. And finally, we work to address systemic issues that are needed to scale solutions. It is vital to address the systemic issues that prevent real change in any organization. And we must have an open mind to creative partnerships and to understand the need to transform the industry, not only where care is delivered.
Great responses. Thank you, guys. So that's taking us to the last question that I have for both of you. And we slightly touched on it again. Since supply is about 80% of scope 3 emissions, where should the environmental sustainability teams begin when it comes to procurement? What are some of the best practices when it comes to execution? Christina, do you want to begin?
Sure, happy to kick this off, and I'll take a broad lens and then dive down into a microscopic level. So in general, the healthcare value chain is made up of largely global corporations who are under significant pressure from investors, stakeholders, regulators, customers to be transparent and accountable for the embedded carbon in products and services. And our advantage comes from leveraging our scale and position in the marketplace, along with our data to help providers benchmark carbon while optimizing performance. And all of this supports the transition to a low carbon economy. We serve as a convener to create closed loop communication systems to ensure alignment and to scale solutions in partnership with providers and our suppliers. And a great example is how we meet and convene with our councils. Terry is actually on one that I facilitate, and also supplier task forces. Soledad, you are on one as well. So at a broad level, I think that's what we're focusing on. If we look and dig down deeper into scope 3, start with data and ask questions. So is there an individual within supply chain that is passionate or focused on sustainability? Do you have a baseline for scopes 1, 2, and 3? Terry mentioned earlier, you have to start with the baseline, and we all know that it's very difficult to manage what you can't measure. If not, there are free tools that exist that can help you determine those insights. So reach out to partners, hint, hint, reach out to me because we have a plethora of tools. Are there suppliers who are sharing data with you? If not, is there language that you can replicate at your own organization? Again, hint, hint, the answer is yes. So it's so important to baseline your data, especially emissions as a starting point. Once you have that, you can dig deeper to evaluate the largest opportunities for change. And then you can assess which partners are being transparent and sharing data, which partners are prioritizing this work and have made public declarations, which organizations have had their goals verified by a third party, like Science Based Targets Initiative is a great one. And then lastly, are there any industry initiatives or collaboratives to scale combined efforts? There are many going on right now. NAM has a climate collaborative, CHARM is another one, but they're all examples of unique collaboratives designed to unite the sector through decarbonization action. I'll turn it over to Terry.
Yes.
Yeah, so that was a really great summary of kind of big picture thinking when it comes to this. And I'll take us down into some more weeds about it. You know, at an organization, when you are trying to design your procurement system to consider more sustainable, you know, attributes of the decision, you got to look internally at your processes and say, where can we fit sustainability into our processes to get a better result or to improve our sustainable procurement results? So I think that you know, might kind of diverge here and say, if you have a supply chain leader or a supply chain leadership team or an advocate within the supply chain team who's willing to engage on sustainability, shoot for the moon, like go for it, like try to establish a sustainable procurement policy that incorporates sustainability into every procurement process, like all of the RFs, right? The RFIs and the RFPs, and how you screen vendors and what you expect to see with those data requests, and build that into your whole procurement process. But it does take a champion within the supply chain organization in order to go that deep. We are also in the process at Stanford of building out specific sustainability guidelines. So one for cleaning chemicals and one for furnishings, and, you know, yeah, et cetera, per kind of category. I'll use the word category loosely, so that the supply chain teams have a little bit more information on how to make those sustainable assessments as they're doing their contracting. But the idea is to embed, ideally we can embed those processes and that kind of information into the existing supply chain processes. So kudos to you if you have a supply chain leader who's willing to take that on. If you haven't determined who that person is, or if you're not sure, then there's also things that you can do. And that includes finding the champions. Again, this is like where your investigative skills come out. Find the champions in the organization who want to make better purchasing decisions, because sometimes the person who's making the purchasing decision isn't in supply chain. They're asking the clinicians what they want. They're asking the nurses what they want. So find those advocates and educate those advocates on sustainable attributes of and implications of their decisions, and try to influence purchasing decisions that way. So there's always something that you can influence or try to tackle within your organization, given the, you know, strengths or opportunities of your particular setting. I will say that most hospitals, most providers anyway, we have a value-based analysis team that, you know, evaluates products either because of supply chain issues or substitutions or discontinuation, whatever it is. And seeing if you can join or influence that value-based analysis team, I think is also like a critical function of the hospital, where you could, you know, have that sustainability voice without coming in with a big, you know, strategy from the top. So I would suggest getting involved with that team.
That's great. And you know, what I'm hearing basically is these collaborations, driving policy, supporting the partnerships, leading to greater transparency in the supply chain and the work that it takes to get there. That's great. Before I kind of close it off and send it back to Jen, do either of you have any final thoughts for the listeners of this webcast? I know we said a lot.
Mm-hmm.
Christina?
Sure. I would just say that sustainability is not going away. I know there have been many rumblings. We're in an election year, but this is so closely tied to healthcare organizations' missions. There's substantial science and research that continues to come out that paints a very compelling argument for accelerating this work. So if you have questions, please reach out to anyone, a provider, healthcare system, a supplier, a GPO, industry group. There's so much incredible work that is taking place right now. And there is a strong national, if not global, movement to back sustainability that will only increase with over the next 1 to maybe even 3 years. So I would just encourage all of you to start somewhere. The time to start is now, and the time to act. And there are a variety of resources, tools, and services available to be able to help you with this work.
Thank you, Christina. And Terry?
Yeah, I'm also optimistic about the healthcare sector's sustainability efforts over the next couple of years. The HHS pledge, for example, is a voluntary commitment that hospitals made, and it is driving so much conversation in the sector that the sector is making sustainability a priority. It's not regulations, although, you know, the reporting and disclosure regulations coming down in the state of California and the SEC are significant, don't get me wrong, but the healthcare's efforts to become more sustainable is definitely, I think it's here to stay. I think that we're going to see increases in healthcare entities contracting with renewable energy sources. I think that that is not only proving to be a cost savings, but it is also driving environmental change. So there is I think that that's going to increase in the future. I think that growth and transparency in the supply chain is just going to increase with the partnerships that providers and suppliers are forming right now, and the coalitions, and kind of being together at the beginning of this journey where we want to evaluate the challenges and overcome them together. I think that partnership between providers and suppliers is just going to lead to increased growth of transparency in the supply chain. And then finally, more healthcare organizations, because there's free tools available now to conduct greenhouse gas inventories and to have that data. We're going to see an uptake in how many institutions are able to conduct those inventories and be able to have more dialogue around what that means and how we're improving on those metrics. So those are kind of the signals to me that I'm seeing that will happen in the next few years. And I agree with Christina, regardless of how the elections unfold later this year, this is a healthcare sector driven initiative right now, and I don't see that changing.
Well
Great.
said.
Absolutely. And I just wanted to add just a couple of little things here. First, I want to thank you both for your insights, your expertise, your sharing of ideas, and experience in your work in sustainability. For those of you out there who don't know, the three of us do work together collaboratively in different facets. It is an example of what's happening in the sustainability space. And I think that's pretty demonstrative here of how you can get different parts of the work done together through different organizations with a shared belief. I want to thank you both so much for your input. And before we close, I want to send it back to Jen, see if there are any questions, and go from there.
Thanks, Zelda. No questions from our attendees. We have another minute. I'm happy to stay on. Oh, we got someone. Perfect. Are there specific provisions within the IRA that support food and nutrition services in hospitals? If so, what are examples of how to leverage those benefits?
Christina?
I defer to Terry.
Okay.
The IRA is heavily leveraged by providers, maybe even a few suppliers, but I absolutely defer to her for her insights.
Yeah, I'm trying to go through my little index folders in my head of what's in the IRA, and I'm not coming up with anything that I remember being food related. Even Soledad, maybe you would know this being in the industry that you're in.
So I have listened to the webinars. The IRA is heavily focused on energy at this point, energy waste, more than anything else. They've not gotten to food suppliers yet, but I know it's just a matter of time. How it does kind of cross center in is with waste, especially food waste. So if you're doing any kind of food waste prevention program, that would be very beneficial. And then, kind of join those webinars from the IRA. They are very, very informative. They happen about once a month, I believe, at this point. So, and they really do provide a lot of insight of where you can start to get some of those cost savings benefits and even rebates.
Soledad, just a quick question for you. I'm not sure if this rings a bell. I know in a prior life, when I was on the provider side of the house, we installed a biodigester to be able to safely and sustainably discard food waste. And
Yes.
I know there was capital required upfront to purchase that piece of equipment and install it. So I wonder if the IRA would be able to provide support for a piece of equipment such as that, which does accelerate decarbonization and the sustainable disposal of food waste.
I'm not exactly sure, but I will say that there are more of those digester companies that are working hand in hand with the waste haulers, and some sites can even get their digesters for free. So that is something to explore. You have to check in with your local waste hauler and see if there are any partnerships in that area with them.
Great, thank you.
Sure. Any other questions, Jen, out there?
No questions yet. I'll give folks another minute.
This was fun, guys.
Thank you so much for having me.
Yeah, thank you. This has been a great discussion.
Thanks. Thank you both.
It doesn't look like there's any other questions, but I'll make sure to get that recording out in the next few days, and appreciate the three of you coming on and sharing your vast expertise, and looking forward to all the work that we see in the future.
Thank you.
Thank you so much.
Thank you, everybody. Have a great day.
Thank
Bye-bye.
you. Bye-bye.